In the race against a deadly virus, hospital workers are finally catching their breath. Daily deaths, 29 reported today, are about a fourth of what they were at the pandemic's peak in December. Hospitalizations, less than 1,000 now, were 3.5 times higher in November.
It's a huge weight lifted off our shoulders.
Dr. Warren Gavin felt overwhelmed by the amount of COVID patients he treated at Methodist and university hospitals. Their numbers have fallen from a high of 200 to about 30.
It honestly feels, I don't want to say normal, but that we're getting back there. It's the first time that I felt confident that we can get back to a normal.
I think this is maybe the beginning of the end. I don't know if we've necessarily turned the corner yet.
Thomas Dazinski is an epidemiologist at the Richard M. Fairbanks School of Public Health.
What these numbers are telling me is that, one, we're doing the right things. Two, that we can control the pandemic by doing those right things.
More than 1 million Hoosiers having at least one dose of the vaccines is a good start, but not enough to have a substantial impact. The big surge of COVID cases attributed to holiday parties and travel is finally over. Winter weather is a great incentive to stay home and socially distant. The concern now is complacency and the arrival of new, more contagious forms of the virus.
Can we get enough people vaccinated? Can we maintain these type of activities before these new variants take hold in the population?
Instead of letting down their guard, Hoosiers are encouraged to roll up their sleeves, stay masked up, and keep their distance.
Now, this delay in getting COVID vaccine here to Indiana is forcing the VA to cancel a couple of their clinics. This is impacting their Marion and Fort Wayne campuses. This delay is being blamed on the winter storm that took place earlier this week. Veterans are being now told to call and reschedule their appointment. Well, state health leaders said yesterday this was a possibility, and it's also preventing them from expanding the vaccine program to Hoosiers 60 and older until sometime next week.
So right now, getting the vaccine in Indiana is still limited to medical and emergency workers and those who are 65 and older. And that is very frustrating for people like William Kuhn. William is 29. He has muscular dystrophy, and he's been trapped at his home for the past year. Wednesday night, he went to Facebook to vent his frustration. "I don't understand why I can't get the vaccine," he wrote. "I've been stuck in my house for over a year, live on a vent and on oxygen." He used the hashtags "Vaccinate the Lion" and "Free the Lion." Now, talking is tricky for Will because of his trach, and it's hard for him to get around. So his father took these images for us and talked with me about the agonizing wait.
We check the websites, almost daily. We're there, and as soon as his number is called, that boom, we're there. But hasn't been called yet, and it's just frustrating because it's been 6 weeks since we've had a vaccine and started this process, and he sees healthy people getting the vaccine, and here's a situation where it is absolutely a death sentence to him. It would be a death sentence to him, and he hasn't gotten it. His number hasn't been called.
The Kuhn family is caring for Will at home with the help of home health aides. They know if Will was in a nursing home instead, getting a vaccine would be no problem.
He was almost being punished for not being institutionalized, for having parents and family members that are committed to taking care of him at home. He's almost, like I said, being punished for it.
When it comes to getting a vaccine, the family insists they don't want to jump the line. They do want to question the decision to draw it so that it eliminates Will and all the other Hoosiers like him. Now, during my conversation with Dr. Profeta today, who works at Ascension St. Vincent, he says he does support this age system. He sees the wisdom to it, but suggests that there's an addition to that, perhaps allowing doctors all across the state to add 10 of their younger but more vulnerable patients to the vaccine list each and every week.